Yeah, so my talk's on improving screening in high-risk populations, particularly the equity aspects of screening. But first of all, I'm going to just briefly cover the fact that people that develop lung cancer more commonly come from the people who are socioeconomically disadvantaged. And we see almost double the number of people in the most deprived group compared with the least deprived group if you split the population into quintiles. So what we have in lung cancer screening is a challenge, because we are going to be asking people to participate who come from relatively deprived groups. And we know from all the other screening programs that they are far less likely to participate in screening. That's true for the breast and the bowel cancer screening programs. So we have a challenge. But at the same time, we have an opportunity, because we have quite a lot of research evidence that shows what encourages people to participate in screening. And these are briefly are getting an invite from the primary care doctor as opposed to from a screening program, and then getting pre-scheduled appointments, reminders, and second scheduled appointments if they don't attend their first appointment. So we know that this works in breast and bowel cancer screening. We've also examined that same effect in lung cancer screening. And the Lung Screen Uptake Trial, run in London in a very deprived group, managed to achieve a 50% uptake rate of the offer of screening, which is pretty good in this relatively deprived group, using all of these techniques. But it also showed that using very tailored, sort of rather clever techniques to address the issues faced by this particular group of people didn't actually make much difference. It seemed to be the fact that they made a decision based on the offer from their primary care doctor to go ahead with screening. However, there is some really good news, and that is the British screening programme, which has now covered around about 30% of the eligible population, has shown some amazing effects on equity in terms of lung cancer outcomes. What we've seen over the course of the programme, since about mid-2021 when we started to screen a lot of people in the programme, is we've seen a change in the socio-demographic profile of lung cancer diagnoses overall in the whole of lung cancer in the UK. This has shown that the people in the lowest quintile of social deprivation, who before the programme had the lowest early stage lung cancer detection rate, have slowly moved to the top, and they are now in the highest group in terms of the early stage lung cancer detection rate. That is astonishing, and it's the first time, to my knowledge, that a screening programme has shown to reduce socioeconomic inequity. So we'll be presenting this. It's quite remarkable. It is making a real difference to policymakers' views on lung cancer screening across the globe, and I hope that people will enjoy the talk later.